So medicine is about the structure. You know, we use doctors ABC, we use the A to E approach. You know, we've got all of these acronyms and ways of learning things, and it's about following that. And funnily enough, what I tend to say in the classroom is the further you go through your training, so you're going to do your Cert 4, maybe you go on to do your diploma. A lot of students want to go on and do their degree. Some may even go on to do medicine, right? I'm also an Australian Resus Council trainer as well. So I teach ALS2 on the weekends, and the more and more training you do, the tighter and tighter we get to the A to E. It really is our structure. So I believe in really building strong foundations, focus on the basics, nail the basics, yeah? If you've got those basics nailed, strong foundations to build on, you will never forget those. It's not as if we just teach it for Cert 4 and we throw it away later. You will stick to that through your whole career in emergency medicine.
Welcome to the show, everybody. My guest today is Joe Karlik. Welcome to the show, Joe.
Thanks, Ben.
Awesome to have you. Can't wait to get into this conversation. Joe, you're a registered paramedic. You've worked for the London Ambulance Service. In fact, you grew up in the UK as a South Coast.
South Coast, yep.
You've worked as a private paramedic here in Australia. You've run a paramedic services company here, contracting to the likes of Warner Brothers Studios. And for the last year, or 5 years, you have been a lecturer of paramedicine at the University of Tasmania. And now recently joined the training team at Australian Paramedical College as a trainer and assessor for the Cert 4 in healthcare and the Diploma of Emergency Healthcare. That's a long intro.
Yeah.
And I probably haven't touched on even half of what you've done, Joe, but mate, I'm looking forward to getting it. You've got a really diverse and colourful career. So
thank you very much. Yeah, it's definitely been an interesting and very exciting career.
Yeah. Your passion is training.
Yeah.
And obviously paramedics, and so APC team is really lucky to have you. We're going to get into hearing about your career experiences, both in London and here in Australia, your challenges, insights, and your personal interests too, which include your research and interest in the practice of mindfulness for paramedics and emergency healthcare. So that is really interesting, very personal interest for me. So I'm really looking forward to talking about that, mate.
Looking forward to it.
Yeah. Now, with all of that career experience that you've had, and as somebody who appears to be as young as you are.
Thanks. I did shave this morning.
Yeah, come on, mate. Some would think that maybe you've had an easy ride and that it's all come naturally to you, but that's not the way it's been. You've had some real personal challenges as well. You're autistic. You're on the autism spectrum.
I am.
And I'm really happy that you're happy to talk about that today, because so many people have got barriers to where they want to be and where they see themselves going. And you've had those challenges too. And we want to talk about how you've managed that and overcome that. So
I'm more than happy to do that.
It's also opened you up to a few superpowers, I think.
Yeah, I think, I know we'll get into it, but I think particularly with autism, rather than looking at it as a barrier, I think look at what your challenges are, develop some skills and ways of overcoming them, and work out what your superpowers are and work to those.
So your superpowers really were as an educator and as a paramedic, but not just that. Right.
Not just that. There are other things.
You're a champion skydiver.
Technically, I probably wouldn't call myself a champion skydiver, but I did. I started skydiving. This was off the back of a career break. Actually, I was probably, and this I guess is all interlinked. Everything we're going to talk about today is so interlinked. So was burnt out, essentially. Just reached the point of burnout, which is really common in emergency service workers. And I knew that I had to do something. And it's difficult being a lecturer and a researcher and not following your own advice. And so I decided that I needed to take some time away from the workplace. I did that, travelled to South Island of New Zealand, ended up doing a tandem skydive in Queenstown. Was bricking it, to be fair, was really worried about it. And got back here, loved it, ended up doing 2 over there, came back, did my course, and down in Moruya by Bateman's Bay. It was incredible, and then naturally just ended up at the New South Wales Champs, and entered the novice category and walked away with a medal, and it's my only ever medal in sport, so I'm pretty stoked about it. But it's a pretty humble community, so it's really nice, and it's good.
Awesome. You've worked with some sportsmen as well, elite athletes, as a private paramedic here in Australia. Can you just briefly explain what your experience has been here in Australia? And we'll talk about obviously LAS.
Yep. So here in Australia, while I was sort of working at the uni, I was also working for a company that contracted to the NRL. So I was sat on the pitch, weekends and Wednesday nights watching the game for free, getting paid for it, which is even better. It's the sport I love as well, so it was great to be able to
watch. We stopped the interview because I'm an AFL fan, man. I don't know if we can proceed.
Hey, look, I just had to pick the sport that was local to me, right?
Yeah, fair enough. No. All right, let's shake hands and move on.
But it was good. Look, mostly we were there for airway management. I can't recall the names, but there have obviously been some incidents in sports like that. Contact sports have the potential for serious injury. Yeah. Of course, it's part of what we do as paramedics is manage that. And so I was available to assist the team docs with airway management if anything was to happen. Yeah.
Okay, wow. So, and obviously, we're going to get into your more of your experience too, as I said, LAS. But it strikes me after meeting you and also reading your brief. We sent you a few questions before the interview. Your passion for the teaching side of this, and that's why you're here, obviously, at the Australian Paramedical College. What do you love about teaching emergency medicine?
So much, but if I had to boil it down, it would be that it can be difficult, but I think if you truly understand it and you can read the room and you can read your students, you can make sure that they get it. So this morning, for example, I was teaching ECGs, which tends to be one that can be quite stressful for students, but just breaking it down step by step. So my keen interest is in the teaching, and I've discovered that is one of my superpowers. So being able to, like I say, get that read on the room, but really understanding the subject and really breaking it down, just being able to describe it in lots of different ways. I don't know what more to say, really. Just it kind of works. I like it. The students like my style, and I love it.
Well, on that point then, would ECGs be one of those topics that you kind of love to sort of nut out and help people? And if that be the case, how do you go about teaching people, helping students understand ECG?
So ECGs and cardiac stuff is one of my interests, and I think it's easier to teach something if you're passionate about it. If you really love something, and just in general, I love paramedicine. So ECGs, for example, I don't touch the ECGs for a good hour, 45 minutes to an hour of that first session until you understand the underpinning anatomy and physiology. And it's something that I've tried to introduce into my teaching, because I think sometimes the understanding of anatomy and physiology isn't probably where it needs to be for paramedics, and we can look at it and we go, I can't see how I'm going to use that upside down in a car, on a racetrack in the rain at night. How is anatomy and physiology going to help me? So we sort of skim over it. The problem is you're never really going to understand what you're doing, what you're assessing and what you're managing and what you're treating, unless you understand what's going on. So for ECGs, for example, we will review the heart. We'll go through the anatomy of the heart, the cardiovascular system. Then we're going to touch on how it works, what can go wrong with it. And then this morning, as the students found, ECGs is then just a little bolt-on. It's not this big scary thing, because the understanding is there. So you've really got to have that basic knowledge. You've got to walk before you can run.
Yeah, so Joe, as now an experienced trainer within emergency or educator within emergency medicine, where do you see students who are maybe new to the whole concept Where do they struggle the most, and how do you help them?
Fantastic. And this is something I've been doing this week, actually, is it's less about the content, I find, and more about the approach. Students tend to get so stressed, and we always find, we give them some skills and they're aiming just for an assessment. Okay, so what tends to happen is you can see them practicing away in the classroom and all they've got in mind is an assessment. And they want to rote learn something. They just it's sort of like prepping for a stage show, like learning lines. And medicine isn't like that. If you learn in that manner, you're going to be really good at one particular thing. So that assessment, maybe a trauma assessment. Okay. But then if I throw something in, if I throw a curveball in and I say, oh, now there's a breathing problem or whatever it be, you can just see the stress build. Some people become a bit emotional, and that's because they've not focused on the structure. So medicine is about the structure. We use Doctors ABC. We use the A to E approach. We've got all of these acronyms and ways of learning things, and it's about following that. And funnily enough, what I tend to say in the classroom is the further you go through your training, so you're going to do your Cert 4, maybe you go on to do your diploma. A lot of students want to go on and do their degree. Some may even go on to do medicine, right? I'm also an Australian Resus Council trainer as well. So I teach ALS2 on the weekends. And the more and more training you do, the tighter and tighter we get to the A to E. It really is our structure. So I believe in really building strong foundations, focus on the basics, nail the basics. Yeah. If you've got those basics nailed, strong foundations to build on, you will never forget those. It's not as if we just teach it for Cert 4 and we throw it away later. You will stick to that through your whole career in emergency medicine. So that's what I focus on. And I think, bring the mindfulness into it. I say to them, look, let's just think about this laterally. Another big thing that happens is people try to make shortcuts. And those shortcuts might save you a few seconds, but it'll throw you out. Yeah, and you see all these weird little things being done. And people feel the pressure of emergency medicine. They feel the pressure of a crisis situation, and they feel pushed to do things as quick as humanly possible. Yeah. But it's not about that. It's about doing things safely. And one thing that I learned in skydiving is slow is smooth and smooth is fast, because you want to be safe.
Slow is smooth, smooth is fast.
Absolutely. So
that's good.
What we've done this week is we've slowed our students down. I've said, hey, just slow it down. And they've got time to think. And it's that allowing yourself time to think. And there are so many transferable skills between emergency medicine and skydiving or any extreme sport. Is that sort of flow state. And again, that links into the mindfulness, which is, I guess, why I am where I am.
Perfect. That's such an important concept to grasp in all areas of life.
Yeah, absolutely.
And it's one thing that mindfulness and a mindfulness practice like meditation has taught me.
Nice.
As well. And I'm not I'm no guru, but just approaching life, parenting, work in a way that's not a panic, but in a way that's actually, no, if I give myself a few seconds to breathe here, yes, someone is in trouble, but if I can operate out of those principles, those base principles, and I can do that systematically and not rush here and there, I'm actually going to give them the most prompt and entire or accurate care.
Yeah, right? Absolutely. It's absolutely that. It's about, and we often say, it's kind of like the duck or the swan. It's very graceful on top of the water, but the legs are going 10 to the dozen underneath. And that's fine, but it's why you don't see paramedics running. Because what happens if you sprint for a bus? You've got to catch your breath. The last thing you want is, an EMT or a paramedic turning up to you who's, out of breath and starting to break a sweat. What you want is someone calm, who, and even if I don't know what's going on and it is a crisis and I turn up and there's patients everywhere, as long as I look calm, I make everyone else calm.
Yeah, absolutely.
And it comes off in the classroom as well. You know, the teacher voice, that sort of slow, melodic voice, it just captures them and it just takes the stress away.
That's so good. We're not in a hurry.
No, definitely not.
Fantastic. It's a great little nugget there that people can take from here until forever.
Yeah, the room's gone very zen in here.
Yeah.
Even the crew are chilling out as well.
Let's have a moment. Eh?
Yeah.
Fantastic. I was going to ask you another question about teaching. What have you've obviously taught in the university at that level for a while now, and obviously brought that work experience into that, and now teaching at a Cert 4 diploma level. What are some of the differences and similarities that you've seen?
I'm actually going to steal something a friend told me from years ago when I was considering doing medicine. And he said, Joe, it doesn't matter where you're at, so whether you be Cert 4, diploma, degree, medicine, whatever, he said it's like a stained glass window. He said it's all the same, it just depends on how bright the light is coming through. So it just depends on the amount of knowledge. The knowledge, I think it's all about the approach. You know, there's only so much that you can learn in a Cert 4 or a diploma, but they're great qualifications for what you need them for. You know, they're excellent qualifications. They're well taught. You come in, you get the practical skills as well. It's about how to implement them. I could teach, you know, a primary school student how to give an injection. You know, we've done it before. We've taught 7-year-olds how to do airway skills or give an injection or whatever, just to prove the point that I can teach a child to do that. But the child doesn't know when to do it, or more importantly, when not to do something. And I think that's the key thing. Skills are just skills.
Yeah.
People will probably be crucifying me for this, because when I was teaching in the uni, we particularly during my last year there during COVID, we really struggled for practical time. So I would actually remove time from practicing cannulation. I'd say, look, guys, you know, you're not going to nail this skill now. Wait till you're out on the road when you're doing it lots and lots. But let's focus on the knowledge behind it. Let's focus on how to interpret information, process that information and make decisions on that information. It's all in the decision making.
That's really interesting. Most people would say practice, practice, practice. And of course, there's time for that. You build that muscle memory.
Yep.
But there's plenty of time for that.
Yeah. You know, the classroom is an introduction. So if students are wanting to prep for workshops, it's going to be, you know, revising those learner guides, because if you pass some of those units 6, 12, 18 months ago, you're not going to have that knowledge, you know, and as an educator, I know you're not going to have that knowledge. It's not going to be fresh. It's going to be hard to bring out of you.
Yeah.
Revise your learner guides, come in with the knowledge so that we can get you using that knowledge. The classroom is a very difficult place to get perfection at anything, because it needs to be contextualized. It needs to have real world application. And I see that in students as well, is they want to leave the classroom perfect. But again, we're educators. I know when you've got the fundamental skills, those foundational skills for you to build on. We'll get the foundation, and then of course students go out, they do 80 hours of practical post workshop 1, come in for workshop 2, they do another 80 hours of placement. That's where you're putting those skills into practice on placement in the real world. You don't have to leave the classroom perfect.
Cool.
Yeah.
So Joe, now you grew up on the south coast of the UK.
Yep.
And at some point you moved to London.
I did indeed, 2006.
Okay.
Yep.
Was that for study in paramedicine, or was that for another reason?
That was for my degree, which was at the University of Hertfordshire. I think at the time it was the only uni doing the course from memory.
Wow.
So yeah, I remember one of my college teachers actually approaching me and saying, hey, look, I found this course, because at the time it was purely vocational.
Okay.
Yeah, and I had never considered going to university. So it was really quite daunting, you know, all of a sudden college teacher saying, hey, I found this, to applying, and my dad driving me up there for the interview and being like, oh wow, I've left my little town, had the interview and thought, oh, there's like 45 people applied for each place, I'll never get a spot, and I got one, and that was it. That September I was off at uni, 18
Wow.
years old.
Wow.
Yeah, even fresher face than I am at the moment.
And so you went on to work for LAS, the London Ambulance Service. What was that experience like? What's it like being a paramedic in one of the largest, busiest cities in the world?
Hey, look, yeah, if you had to say one word, it would just be incredible. Just incredible. There's so much, we
Yes.
could talk about this for hours, but the places I went, within the same postcode, I could be, in a millionaire's apartment overlooking the River Thames. And then my very next call, 300 meters down the road, I'm in someone struggling to buy food,
Wow.
in someone's apartment struggling to buy food.
We're not used to that diversity here, that stark.
Yeah, that
diversity here.
stark
Yeah.
diversity and just the disparity and how it's just all there in one, ecosystem type thing. But just incredible. I've had calls to the Houses of Parliament. I've been inside the Home Office where you have to go through these weird doors that are like security bomb door things, and there's signs to the bomb shelter. I've had to go to some of the monuments, into the tube system, underneath trains on motorways. Oh my gosh, it's just incredible. Absolutely incredible. It's busy, a hugely diverse population, and with that comes a lot of different medical conditions that you maybe don't see without that diversity.
Wow. Surely that sort of experience was probably a good primer for you in not only witnessing and experiencing diversity of human experience, but also obviously just the training, just the amount of practice that you're getting, probably different from a country town in Australia or even the UK, right?
Definitely. Both have their benefits. I would say working in such a busy city, and I think any city, Brisbane, Sydney, Melbourne, it's going to be relatively similar. You've got these quicker turnarounds. So you may be on scene for a short amount of time. Your travel time to the job is 5 minutes, to the hospital, maybe 10 minutes or whatever. And you get through a lot more. You see an awful lot more. And I think what also happens is with seeing, that amount of jobs in a day, you just, mathematics says you're going to see so much, and you do. There's great times delivering babies, maybe giving a drug, fixing an asthma attack or something, can be that very quick turnaround. But then it comes with some difficulties. I've had a gun pulled on me in London. I've had knives pulled on me, and we do tend to see that on the paramedic and ambulance shows. It's not as often as some might think. I've only had thankfully only two or three episodes of violence in my career. But it definitely also has an impact on you. That quick turnaround time, the missing the meal breaks, the overtime. We all say that it's part of the job, and it is. It can be part of the job, but it has a significant impact. And coming from a small town, going into a big city like that, there's a culture shock as well. And so, I personally left London after a couple of years and ended up moving only a few miles away in the UK to the next ambulance service to get back to the countryside. Longer travel times, longer with the patient as well. So you got to do maybe a bit more. But really tuned into my values and my needs, and realizing that again, was just exhausted. Weekends, nights, not seeing family, not seeing friends, and being a paramedic, your social life and your family life can certainly take a hit. But so glad I did it. It was amazing. Yeah.
And paramedics can work in probably more diverse areas of the sector, the health sector over there, as I understand. Is that right?
Yeah, absolutely. I think it was probably born out of a bit of shortage of health professionals. So we had a real shortage of nurses, but it's really exciting. Paramedics work in GP practices. They work in emergency departments. They work in medical admission units, but they also can work in places or for teams such as like mental health response teams, falls teams, stroke teams. They can work in the prison sector, police custody. It's so varied that becoming a paramedic has many more options. I think it's going to come. I really do. I think registration is an amazing thing that provides the professionalization that will allow us to advance our profession. So yeah, being a member of the College of Paramedics, coming in, doing your certificate, your diploma, and really getting into the profession, I think now is a fantastic time. Be ahead of the curve.
Yeah. So, and how does that then experience over in London compare to then coming here to Australia? And obviously you haven't worked for the state service here, but still as a private paramedic. What are some of those differences that you've seen?
I think for me, my initial reaction, it felt quite protocolized. And I think my initial reaction working at the uni was just following these scripts, these protocols, and particularly at the University of Tasmania in Sydney, there's such an incredible team there with such a huge variety of experience that, how I mentioned earlier, talking about just getting that structure and how to think, that's really pushed into their paramedic students. And to see clinicians coming out, and returning, we've got so many Aussies over in London who are going to be coming back over the next few years, and you can see how things are changing, going to that real clinical approach, really thoroughly using patient assessment, and bringing that back here and putting that into practice. So I think that was the biggest thing I noticed, was that practice style. But there's other challenges here, and there's things that really took me by surprise. It can be how long you wait for an ambulance, your travel times to hospitals, the services. You've got RFDS, you've got your helicopter networks up here in Queensland. It's incredible, and that was also quite a surprise to me.
Right. What would you say has been a highlight in your career? There's probably many, but what comes to mind as something that has significant, that you kind of carry, one of those events, seemingly big or small, that comes to mind as something that you feel like shaped you, maybe inspired you to keep going, working in the sector? Is there something that comes to mind?
I'm actually finding that a really hard question, and I don't know why. Maybe it's because there have been so many. I have, every time I have moved on, whether it be to move to Australia or to come here to the Gold Coast, I've really missed the people I work with. I think I have learnt so much from some amazing people. I think if I had to say, I'm just glad I stepped outside of the ambulance service. I think it's a highlight that has just been going for years and years and years, was the confidence, or to have the confidence to step outside of the ambulance service into independent or private practice, to have confidence in my skills and abilities, to work in sort of with sports, with elite athletes, to have done stuff alongside the Olympics, to have worked with incredible emergency physicians at festivals, to have worked in the film industry, and then to come to Australia and now be an educator, and to get to pass that on. I just love calling on my experience.
Great answer. I'd love to talk about now your own personal challenges. As someone with autism, many would see that a diagnosis, whatever it may be, as a barrier and a no-go to some of their career aspirations or what they want to do in life. And it strikes me as someone who not only needs to be cool, calm and collected in, an emergency situation, working with others, communicating with others, and then someone who then communicates maybe at the highest level of education as well. And you seem to have really embraced that. Can you talk about how you've been challenged?
Yeah, absolutely. I got the diagnosis as an adult, so post becoming a paramedic. And I think some of the challenges can indeed be communication. And so, yeah, autism spectrum disorder, and I don't like the term disorder, but yeah, being on the spectrum, it is indeed a spectrum. So there's that saying, if you meet one person with autism, you've met one person with autism.
Yes.
So it impacts people differently. And we've spoken about superpowers. And one of the great things is I've had some fantastic supporters around me who have helped me focus on my strengths, recognizing weaknesses, but not beating yourself up about them. And I think that's the real key, particularly with and my language around sort of medical conditions and disabilities. I don't like saying the word disability, differently abled or whatever. I don't like to think of it as a disability. We're all on this planet together, and we are all different in our own way.
It's fairly polarizing, is it? That's bad, that's good.
Yeah.
Disability is obviously bad.
Absolutely. And I think that's the problem, is that we talk about it as a disability and you sort of get labeled, and you're filling in an application form for a job, any disability, and you're like, oh, if I tick this, I might not get the job. And do you know what? I do tick that box now. I never used to, but I'm like, actually, I'm going to tell you about my strengths. And particularly when I interviewed staff, and if you talk to anyone who interviews for staff, they'd much rather someone who knows their weaknesses and has learnt to manage them than someone who isn't aware of their weaknesses. Challenges for me have sometimes communication. So
it wouldn't appear so, Joe, but you've obviously done some work, mate.
Yeah, look, absolutely. And I think that can be the difficulty with a hidden disability. I'm going to do air quotes, hidden disability, that you can be taken on just your appearance. And yeah, you're right. Yeah, I've had a lot of practice for this, but I'll tell you what, my first few lectures at the uni, oh my gosh, I was so scared, right? My heart was in my throat. I couldn't talk. I had to get water because my mouth was dry. It was just, but then you ease into it like anything, So yes, I can be mindful and very aware of the moment. Doesn't mean I don't feel those things.
No.
But yeah,
you're more aware of those things.
More aware of those things. Right. But I'd say, yeah, look, communication, I think, if you Google any article on autism, it'll say communication is a thing, is an aspect, an element of that. And a lot of, like I say, working with a specialist with autism, I've learned that non-autistic people often have a lot of emotion embedded in the words, in the sentences, in what they're trying to say. Whereas actually, probably one of the reasons, good educator, good as a paramedic, is there's no emotion. What I say is what I mean, and what I mean is what I say. So it allows communication to be quite clear. But I guess at times it can come across a bit blunt. And I certainly don't mean that to be the case, but if I, trying to interpret people's intentions and emotions, and trying to sort of essentially decipher, listening to people, and for me, having a conversation with someone, it can almost be like I'm having to translate English into another language. It can be that level of effort, so it's pretty tiring. You can be bombarded with questions by students. You just, like anyone, you're just using your brain, and you can just get to the end of the day and be pretty pooped. And I know that's the case for anyone, but there's that sort of extra level of interpreting and working everything out that can really smash you.
Yeah. So that's been a real process for you to come to terms with that and see that as potential strengths. Recognize the weaknesses as what they are, or let's do the air quotes, weaknesses, and see the underlying strengths in those. And so that kind of moves me into this whole area of mindfulness. Has that been a practice for you that has helped you? Is that why you got into, or you're interested in this sort of mindfulness practice? Is that the catalyst?
It was definitely one of them.
Yeah.
I think sort of the burnout and working in big services with long hours and that sort of expectation of overtime, running a business, it's definitely not your 9 to 5, being on set in London from 8 in the morning till 6. Well, that's the standard hours. I've then got to be in before the crew and out after the crew. We'll do a few hours overtime, couple of hours overtime, so you can have 14, 16-hour days quite easily on your feet. And then, of course, running a business, maybe there's stuff happening outside of that.
Yeah.
Someone calls in sick. And I was just acutely aware how, we look after our physical health. We go to the doctor when we've got pain. We take medications. We try to eat well. Maybe we exercise. We know that we should be doing exercise. And if we're not doing it, we know we should be. We know that we should be eating well. But we don't look after our minds. And I saw this as quite a significant gap, particularly given the trauma that paramedics and emergency healthcare professionals and other first responders and many other professions are exposed to. And I went, no, there's something missing here. And that's how I first got started with it. Very first got started.
So let's break it down for someone who's new to this whole concept. When you say mindfulness, some people might think of somebody sitting in a meditative position and doing that. But what is mindfulness? What are we talking about, and how do people start to practice it?
Yep. So mindfulness essentially is awareness of the present moment. That's it. It's awareness of the present moment. But when you start, it can be pretty difficult. And you've got to be pretty careful if you are coming at mindfulness from a place of trauma. You need to have trauma-sensitive mindfulness. You've got to have trauma-aware facilitators, because what tends to happen is you can end up being a bit more present. And as you know, you start to focus on the breath. So one of the first things you do is you focus on the breath, because it's 2021. We are just constantly distracted by our environment, our phone. And there's evidence out there that says how many times we look at or touch our phone. There's that thing where you think your phone's vibrated in your pocket, but it hasn't. That's how sort of in tune with tech we are.
Yeah, right. Yep.
If you try to detach from that for a moment, even if you took 20 minutes out of your day just to sit down and think about the breath, not necessarily on breathing, but the breath, because there's nothing else to distract you, you become more aware of your thoughts. And so that can be problematic for those who have experienced trauma, because you can end up ruminating on some of the stuff that has happened. But the idea is to accept the thought for what it is, not have an emotional reaction to it. And again, it sounds much easier than it is, and it does take practice.
Doesn't it? Yeah.
You don't go into the gym and lift the heaviest weights. You start at the beginning and you work through. And so maybe you just do 10 minutes. Maybe you just recognize that your head is full of thoughts. And I think that's the first step, is just to say, wow, there are a lot of thoughts. There are a lot of things going through my head. And that's the first step, is just recognizing that.
Yeah.
The next step would be to not apply judgment to that. And this is where sometimes we can start to lose people, because they go, oh, this is starting to sound a bit, a bit out there. And it's like not beating yourself up about something. Let's say you forgot to do something with a patient, or you made a mistake. Learn from it, of course, reflect on it, and change your practice. But don't beat yourself up about it. And it's moving on like that. Oh, I forgot the milk. Now I can't do this or whatever. and then that's really sort of starts to develop, where you're just accepting of the present moment, you know. And I think one of the key things about mindfulness is that it's not about having no thoughts, because I think people sit there and get really stressed out because they're like, oh, I'm meant to have an empty head. No, it's not about that. It's about recognizing a thought that comes in, trying not to have a significant reaction to it, and letting it go. And that is what, you know, I can do that for 15, 20 minutes and I just feel so chill afterwards. It's quite incredible.
But nobody's really good at it to start with. As you said, you don't go into the gym and lift the heaviest weight. I've heard a lot of people say, oh, I've tried mindfulness, but I can't do it. It's like, yeah, you can't do it. You're not going to be able to do it. And almost can't do it is the first step of accepting that you can't do it. Awareness of all the craziness that our mind is what's happening in our mind at the time, and accepting that as what it is, and not trying to push away what is happening in your mind, but fully almost receiving it and embracing it. And that can be challenging, if you're a busy person, you've got stuff on, all that sort of stuff, but especially so, as you said, if you're experiencing trauma.
Yeah, definitely. And you know, there are people out there that who know far more than I do about it. I'm very much at the beginning of my research, finding it really exciting and finding the connections that it has to things like extreme sport. So yeah, there's some evidence out there that says actually those who do extreme sport have something called trait mindfulness. Generally, they just have a bit more inbuilt mindfulness in them, and that's what they're using within that extreme sport.
Wow,
you know?
That's interesting.
Yeah, but you can build it. You can build mindfulness via practice, and again, there's a lot of evidence out there that says actually feeling a bit anxious. So this comes from elite athletes like tennis players, that kind of thing, where they question them on anxiety scores and emotion scoring. And what they found is if you have a bit of anxiety pre-game, and let's translate this to students, if you've got a little bit of anxiety pre-assessment, that's actually really good for you. You'll perform better. If you get the symptoms, like you feel nauseated, butterflies in your stomach, feeling sick, there's a bit of evidence to say that that might impact on your performance. But the mental stress can be really good for you. It actually improves performance.
So it's almost something I love that idea of like something that I've wanted to push away, like being anxious. Like, I don't want to be nervous, but that's the stress in the pushing away. I wish I wasn't so nervous, but actually embracing that is like, this is a good thing. This is going to give me almost what I need to perform really well. And that's just one of the examples of those of mindfulness and how it can be so powerful, right? Yeah,
definitely. One of my tunnel instructors. So as a skydiver, we train in the indoor tunnels that you might have seen in the big cities, and my instructor, just fantastic guy, he once said to me, Joe, there's no difference between fear and excitement. It's just the interpretation of those feelings. And I was like, oh, wow. You know, it's the same reaction, the same adrenaline reaction that you're getting. It's just your viewpoint on it. You know, it's either something scary or something exciting. And if you can start to bring it to the excitement side of things, you lose the fear.
Wow. Wow, that's really important. So maybe apart from the obvious, I want to ask, what potential does mindfulness hold for paramedics? And do you see it as being some sort of future where it's a part of the protocol? Can you talk on that?
I really hope it is something that becomes part of paramedicine. I'm actually doing my meditation and yoga teacher training at the moment because I really want to be involved in this. I've applied to be on a committee with the College of Paramedics as part of the wellbeing group, and there is so much evidence out there, sadly lacking with first responders and paramedics, but there's so much evidence out there looking at emergency nurses and physicians that says mindfulness reduces burnout. it reduces anxiety, it reduces depression, it improves physical health. The evidence is there. We just need to be doing it. And thankfully, state services, have been listening to this, and you can see a lot of state services, are now building programs to manage this. But yeah, I very much see courses and mindfulness having a place, and hopefully at the front end. Why not be putting it into the degrees? We are teaching our paramedics on their Cert 4s, on their diplomas, how to care for patients. Maybe they go on to university and they're then doing a degree. We're focused on the patient. Very little of that is spent on looking after yourself. And so I really hope that we see some change in that area.
Yeah, fantastic. So someone's listening now hasn't maybe started a mindfulness practice and is maybe curious to do so. One, I would say start and give it time. But what are some ways in which they can start? How have you found benefit, like maybe in the start? Is there an apps that you would recommend, or how does somebody begin?
Yep, I think there's the Headspace and the Smiling Mind app. I forget which is which, but one of those is free. There's the Sam Harris app. I find the Sam Harris app, it's incredible, and there's a lot in there. I would recommend probably using the Smiling Mind or Headspace app first. That's more of a beginner introduction. If once you've got used to that, Sam Harris is probably a step up from that, and his work is incredible. He's his PhD in neuroscience, and he's gone to Nepal and trained with some of the masters in meditation. So his stuff is awesome, but I'd say probably a little step on.
Yeah, and it's somewhat intellectual.
Yes.
As well, conceptual. I find Sam Harris has been really helpful for me, but I kind of have to have a break from his stuff.
Yes.
And maybe go to some of the apps that you talked about.
Likewise.
But I find it's inspiring though for somebody of Sam's caliber and education and knowledge in whatever you want to talk about the world and consciousness and all this sort of stuff. Sam can talk about it with the best of them.
Yep.
But he's putting all his energy into training people, all the best of his energy into his number one passion, and that is teaching people how to be more mindful. And if that doesn't tell you that there's a nugget of value there.
Yep. Absolutely.
And nothing will.
Oh my gosh, if I could meet that guy. But you're spot on, and you can see it just happening everywhere. I think you can start to see whether it be yoga, because yoga is a form of mindfulness, but it's with physical activity and it's really good for you. It's stretching, and as paramedics, sometimes you don't move around as much as you should. You finish late doing long shifts, maybe you're not exercising. So yoga can be a great way to get into mindfulness that has a physical, practical component combined with it. I think one key way to get into this is probably structure. So with the Headspace and the Smiling Mind app, they nudge you on your phone. And again, we've sort of spoken about how phones can do that, but they can give you a little bit of a nudge for 7 days, 14 days, 3 weeks, 4 weeks, or whatever. Just say, hey, have you done your meditation today? Have you done your mindfulness? And it can be as simple as writing a gratitude journal, whatever it is. But that can be super helpful for beginners, is to have that sort of essentially accountability. Maybe you do it with someone who holds you accountable. Maybe you use the app to keep you accountable. But having that structure, it's like going to the gym. You're not going to see any change if you don't go. But also you don't start the gym and go for 7 days. So it's also about building habits, and there's habit building apps out there. There's, putting something on your fridge and reward yourself. It'd be amazing. We love dopamine. That's why we love seeing notifications on our phone. That's why we love seeing likes on our posts. It's a massive hit of dopamine. You get that by putting a gold star on a fridge like you do for your kids. But as an adult, you do that as well. Just the reward's got to be different, right? Maybe if I do this for a month, I get to buy myself this or do this or whatever. So I'd say it's about habit forming, and it's about also a bit of self-compassion. Don't be too hard on yourself. Start slow, a couple of days a week, build up from there.
That's excellent advice. So, Joe, I think we're coming to the end of our conversation. I'd love to know, as somebody who's had so much contact with students, gone through your own journey, is there any sort of advice that you would give to students starting out, whether it be in a Cert 4 or diploma or university level, or those people kind of considering paramedicine, emergency healthcare, even healthcare in general as a career? That's wide, a general question, but what sort of advice would you package up for them?
I guess I would say take the stress off when you come to the classroom.
Yeah.
You remember that the classroom is a learning environment. It is the perfect place to make mistakes.
Yeah.
Mannequin isn't going to die. No one gets hurt. You've got instructors, educators around to help you. Use that time, and just remember, you don't have to leave in a position of perfection. It's just building foundations. And I guess my final bit there would sort of be the A&P, the anatomy, the physiology, the science behind it. It influences paramedicine so much, or emergency healthcare so much. Right. And enjoy it. Take it easy, enjoy it, and look after yourself.
Fantastic, mate. It's been such a joy to talk to you.
Thanks,
Joe.
Ben.
I really appreciate your time, mate. And I'm really pumped for the students at APC. They're going to get some Joe time at workshops and online.
Yeah.
With your experience and your heart and passion for education, I think it's just a fantastic thing. So. Thanks so much, mate.
No worries. Thank you, Ben. I'm looking forward to it.
Yeah, awesome.
Take care.